Hi guys, welcome to the Jacinta Polley Healthy Living channel. Today's video we'll talk about the risks of contacting of conjunctivitis. Conjunctivitis, also known as pink eye, is an inflammation of the conjunctiva. The conjunctiva is the thin clear tissue that lies over the white part of the eye and lines the inside of the eyelid. Pink eye conjunctivitis is an inflammation or infection of the transparent membrane, conjunctiva, that lines your eyelid and covers the white part of your eyeball. When small blood vessels in the conjunctiva become inflamed, they're more visible. This is what causes the whites of your eyes to appear reddish or pink. Pink eye is commonly caused by a bacterial or viral infection, an allergic reaction, or, in babies, an incompletely opened tear duct. Though pink eye can be irritating, it rarely affects your vision. Treatments can help ease the discomfort of pink eye. Because pink eye can be contagious, early diagnosis and treatment can help limit its spread. Children get it a lot. It can be highly contagious, it spreads rapidly in schools and daycares, but it's rarely serious. It's very unlikely to damage your vision, especially if you find it and treat it quickly. When you take care to prevent its spread and do all the things your doctor recommends, pink eye clears up with no long-term problems. Symptoms: the most common pink eye symptoms include redness in one or both eyes, itchiness in one or both eyes, a gritty feeling in one or both eyes, a discharge in one or both eyes that forms a crust during the night that may prevent your eye or eyes from opening in the morning, tearing. When to see a doctor: there are serious eye conditions that can cause eye redness. These conditions may cause eye pain, a feeling that something is stuck in your eye, foreign body sensation, blurred vision, and light sensitivity. If you experience these symptoms, seek urgent care. People who wear contact lenses need to stop wearing their contacts as soon as pink eye symptoms begin. If your symptoms don't start to get better within 12 to 24 hours, make an appointment with your eye doctor to make sure you don't have a more serious eye infection related to contact lens use. Causes of pink eye include viruses, bacteria, allergies, a chemical splash in the eye, a foreign object in the eye in newborns, a blocked tear duct. Viral and bacterial conjunctivitis: most cases of pink eye are typically caused by adenovirus but can also be caused by herpes simplex virus, varicella zoster virus, and various other viruses, including the virus that causes coronavirus disease 2019, COVID-19. Both viral and bacterial conjunctivitis can occur along with colds or symptoms of a respiratory infection, such as a sore throat. Wearing contact lenses that aren't cleaned properly or aren't your own can cause bacterial conjunctivitis. Both types are very contagious. They are spread through direct or indirect contact with the liquid that drains from the eye of someone who's infected. One or both eyes may be affected. Allergic conjunctivitis: allergic conjunctivitis affects both eyes and is a response to an allergy-causing substance such as pollen. In response to allergens, your body produces an antibody called immunoglobulin E, IgE. This antibody triggers special cells called mast cells in the mucous lining of your eyes and airways to release inflammatory substances, including histamines. Your body's release of histamine can produce a number of allergy signs and symptoms, including red or pink eyes. If you have allergic conjunctivitis, you may experience intense itching, tearing and inflammation of the eyes, as well as sneezing and watery nasal discharge. Most allergic conjunctivitis can be controlled with allergy eye drops. Conjunctivitis resulting from irritation from a chemical splash or foreign object in your eye is also associated with conjunctivitis. Sometimes flushing and cleaning the eye to rid it of the chemical or object causes redness and irritation. Signs and symptoms, which may include watery eyes and a mucus discharge, usually clear up on their own within about a day. If initial flushing doesn't resolve the symptoms, or if the chemical is a caustic one such as lye, you need to be seen by your doctor or eye specialist as soon as possible. A chemical splash into the eye can cause permanent eye damage. Persistent symptoms could also indicate that you still have the foreign body in your eye, or possibly a scratch over the cornea or the covering of the eyeball, sclera. How pink eye can be contracted: viral and bacterial conjunctivitis tends to spread when infected particles make their way onto the eye's surface. In addition to sneezes, coughs, and unwashed hands, pink eye can be caused by other illnesses, such as a cold or flu. Allergic conjunctivitis can flare up when your body has a reaction to specific allergens in the air. Pollen is the most common culprit. In the case of a condition called giant papillary conjunctivitis, contact lenses are often to blame. Removing the lenses for a while usually fixes the problem. Conjunctivitis is most often spread through direct contact with the eye by hands or objects that are contaminated with the virus or bacteria. It can also spread via respiratory tract droplets. Allergic conjunctivitis is not contagious. Risk factors for pink eye include exposure to something for which you have an allergy, allergic conjunctivitis, exposure to someone infected with the viral or bacterial form of conjunctivitis, using contact lenses, especially extended wear lenses, complications in both children and adults. The pink eye can cause inflammation in the cornea that can affect vision. Prompt evaluation and treatment by your doctor for eye pain, a feeling that something is stuck in your eye, foreign body sensation, blurred vision or light sensitivity can reduce the risk of complications. Preventing the spread of pink eye. Practice good hygiene to control the spread of pink eye. For instance, don't touch your eyes with your hands. Wash your hands often. Use a clean towel and washcloth daily. Don't share towels or washcloths. Change your pillowcases often. Throw away your eye cosmetics, such as mascara. Don't share eye cosmetics or personal eye care items. Keep in mind that the pink eye is no more contagious than the common cold. It's okay to return to work, school, or childcare if you're not able to take time off. Just stay consistent in practicing good hygiene. Using conscientious hand hygiene when handling contact lenses and discarding disposable contact lenses as recommended can also prevent conjunctivitis. It is also important to stay home from school and work until eye discharge has resolved to prevent spreading the infection to others. Preventing pink eye in newborns. Newborns' eyes are susceptible to bacteria normally present in the mother's birth canal. These bacteria cause no symptoms in the mother. In rare cases, these bacteria can cause infants to develop a serious form of conjunctivitis known as ophthalmia neonatorum, which needs treatment without delay to preserve sight. That's why shortly after birth, an antibiotic ointment is applied to every newborn's eyes. The ointment helps prevent eye infection. How is conjunctivitis treated? Treatment for conjunctivitis is typically focused on symptom relief. Artificial tears and eye compresses may alleviate symptoms. Contact lens wearers may need to stop wearing contacts until the infection resolves. Antibiotic eye drops are typically not needed as most cases of conjunctivitis are caused by a virus. However, they may be prescribed for infections suspected to be caused by bacteria or herpes simplex virus. Allergic conjunctivitis may be treated with medications that help control allergic reactions, such as antihistamines and mast cell stabilizers, or drugs that help control inflammation, such as decongestants, steroids, and anti-inflammatory drops. While conjunctivitis can cause unpleasant symptoms and unsightly discharge, it is typically not a serious infection and resolves without long-term effects. Please don't forget to subscribe to our channel for more recommendations on health, relationship, lifestyle, and other helpful information to form life easier.